You have an appointment with your doctor and he wants to put you on a new medication. Do you know what questions to ask about this new med? By the end of this video, I will give you 7 questions to always ask when your doctor wants to prescribe a new medication. And if you stick with me until the end, I'll tell you how to possibly save money with that new medication. Good morning, health-minded people. I'm Dr. Snow, and I help you treat minor health issues naturally. And I work with clients and their physicians to make sure that they are on the fewest medications necessary to ensure the best outcomes possible. But what questions should you be asking when your doctor says he wants to start you on a new medication? Information is power, and the more informed you are about your own health, the more power you have over your health. The first question you should ask is, what is the name of this medication and what is it used for? It never ceases to amaze me how many people blindly take medications prescribed by their physician without having a clue as to why they are taking it. Every week someone will come into the pharmacy and they want a refill on their little white pill. They don't know the name of the med or the reason they take it. They only know that their doctor told them to take it, and so they do. They have handed over complete control of their health to the provider. And while you should trust your physician, if you don't, find a new one. You should never blindly trust anyone who can literally cost you your life if they make a mistake. So the first question you should ask is, what is this medication for? Did you even know you had the condition the provider mentions, such as diabetes, high blood pressure, or depression? If not, it's time for more discussion about your diagnosis. The second question you should be asking after you find out what the medication is for is, are there any lifestyle changes that you might make to avoid taking the medication altogether? Do you need to lose weight to get your blood sugar down? Can you exercise to lower your blood pressure or relieve depression? Of course, you also need to ask yourself if you're willing to make these lifestyle changes in order to avoid the med. Is the new medication being used to treat a side effect of a medication you are already on? If you're dizzy because of your blood pressure med, rather than starting meclizine for the dizziness, can your blood pressure med be changed to something that won't make you dizzy? Is your Cardura or doxazocin causing urinary incontinence, and rather than starting ditropan for this problem, maybe your Cardura for your blood pressure could be changed? Sometimes the answer is no, and you really do need this medication to avoid complications in the future. And that's okay. Medications are not the enemy, but they should be used as the last resort, not the first. So question number 3 that you need to ask your doctor is, what side effects should you expect from the medication? Is it going to make you drowsy so that it might not be safe for you to drive? Will it make you dizzy, increasing your risk for a fall? Will it make you sick at your stomach, which is possible with some diabetes medications? Will it make you constipated or cause diarrhea? And will these side effects eventually go away? And how long is that going to take? If you're learning something new, please hit that like button. The 5th question you need to ask is, are there any drug interactions that you should be concerned about with the medications you are already on? For example, if you are on warfarin, there are many antibiotics that interact with this med. Some antidepressants should not be taken with other medications. Plavix, which is another blood thinner, doesn't work if you're taking certain stomach meds. These interactions can have serious consequences, and you and your doctor need to be aware that they can occur, and a different medication might be more appropriate for you. If this information is helpful, please consider subscribing to my channel. And don't forget to hit that little bell so that you'll be notified every Monday when I post a new video that's designed to help you navigate the sometimes confusing healthcare system. The 6th question goes along with question number 5. Are there any over-the-counter medications, vitamins or supplements, or foods that you should avoid while taking this medication? Iron products and antacids such as Mylanta or Maalox can interfere with the absorption of many medications, rendering them useless. Aspirin, naproxen, and ibuprofen should not be taken with blood thinners, except under the supervision of your provider. Prilosec should not be taken with Plavix or clopidogrel. Grapefruit should not be eaten while you're on certain medications because it interferes with the elimination of the meds, causing them to build up to toxic levels. These are important questions that you need the answers to avoid complications, so make sure you ask them. Now you know that the medication doesn't interact with your other medications or with the non-prescription products that you take. You need to ask question number 6. How long will it take for the medication to start working? You may see some benefits from the med in the first few hours, as with pain meds or steroids, but some medications take longer. You should see some improvement with an antibiotic within 24 to 48 hours. So if you don't, does your doctor want you to let him or her know because you might need a different antibiotic? Blood pressure medications usually start working within 12 to 24 hours, while blood sugar medications may take up to 3 months before you see the maximum effect, and medications for depression usually take 2 to 3 weeks before you see any relief from your symptoms. You need to know these time frames so you know when to call the office because you think it's not working. Have you ever considered working with a health coach that specializes in medication therapy management to optimize your medication therapy, save you money, and help you live the healthiest life possible? I've had a few openings in my coaching schedule open up recently, and I would love to jump on a call with you to see if working together would be a good fit. I will leave a link in the description below. The answer to the 7th question may save you a lot of money. Does this medication come in a generic? New medications only come in brand name, and brand name medications cost a lot of money. Even if you have insurance, most likely a brand name medication is going to be on the 2nd or 3rd tier of the preferred products list, and your copay may be 2, 3, or more times as much as a generic copay. If the medication doesn't come in a generic yet, ask your doctor if there is an alternative med that would be just as appropriate and does come in a generic to save you some money. If you have found this information helpful, but want more information on how to have a successful doctor's office visit, click and watch this video now. Thank you for joining me today to learn what questions you need to be asking your doctor when he or she wants to start you on a new medication. Stay healthy, ask for a generic, and have a blessed week.